One of the things that's come up is, we get asked every once in a while, is about electronic health records. And there's several issues. Every doctor is just pounded by every new EHR company around. Buy our system, it's better than everybody else, you'll make more money and all that kind of stuff. Two issues that we believe for our practice patients and our franchisees. Number one is there's the electronic health record, all right? And then there's the billing part. And if you really look at what happens, most doctors look at it as one total electronic health record, but it's two separate issues. We are a strong and large fan of Amazing Charts, all right? And for one very good reason, all right? Number one is it is the only EHR medical record for the EHR part that has been made, and essentially the story with it years ago is actually quite interesting. Is there was a physician back east that was a programmer, all right, and a physician, primary care doctor, and he kept, he was always interested in the newest EHRs, and finally he got fed up and said, I can write something better than this, and he literally wrote his own EHR. It's sort of like the Bill Gates story. He started selling it in his garage to the local doctors locally, and it went in. Today it was bought by Pri-Med, and it's all across the country. It's one of the largest. But it is the only EHR that I know of that's written by a physician and is intuitive for physicians to use. It works the way we think, all right? It's very valuable. Number two is that there's the second part, the billing part, the EHR, and most EHR companies are trying to sell you on the billing component, i.e. you're going to make more money, you're going to optimize your coding, you're going to do this, do that. We don't care because, as you know, for a direct payment care practice, I don't charge insurances, so that's not an issue. And Amazing Charts is a little bit weak in that area. They're actually getting better. But the very big thing about Amazing Charts is that it is the best EHR, I believe, from an intuitive perspective, from a physician's point of view for primary care, for documenting. It's phenomenal. And if you are not using Amazing Charts and you're not a franchisee, we call Amazing Charts because they will give you a demo for 6 months to try for free. And it's amazing, literally. The second thing that we've done for our franchisees is we've taken Amazing Charts and we use also a Twin Oaks billing company and QuickBooks, and we've married all those three together, all right? So you click one time and it goes through everything and you don't have to duplicate everything. Also, it makes billing much easier. Number three, most physicians are poor or don't understand accounting jargon, things like that. So we've changed it. So instead of here's your ROI, most physicians, I don't know what that is. Instead, we said, listen, click on this button. This is how much money I made today. This is how much I made this week, this month, whatever. It's in simple doctor's language, all right? We've gotten rid of that, I was going to say legalese, it's not the right word, but all those terms that most of us physicians don't really understand. All those accounting terms have made it easy. And the third thing, why we've put so much money into this, and it's a lot of money, I hate to say it, but it's big bucks. But it also helps for tracking and for making sure that there's special safeguards for our franchisees so people don't steal from them in your office, all right? But that is the most important thing with EHRs, and I strongly encourage, if you're a physician out there, think about those two separate parts of the EHR, because they are both different, and you want to look at what do I want, where's my best options, and is this going to fit for me?